My name is Anna K. Rule and welcome back to my channel. I'm a registered nurse, licensed to work in New York and Florida. I hope you're doing well. I hope you're having a good week and thank you for watching. So this time around, I actually want to talk about sexually transmitted infections or sexually transmitted diseases, or STDs as the term is popularly known as. And I want to talk about this topic because one of the things is that I find that sometimes when a person asks us to get an STI test done, then sometimes there's a stigma attached to it that we're thinking, oh, maybe, that person might be promiscuous or they have multiple partners. But it's just important to know your status. And when I say your status, I don't mean only your HIV status, because that is very important as well, but also your status in terms of other sexually transmitted infections. So one of the things that I said, when you go for your annual, whether it be with your primary care provider or with your GYN provider, do ask them to add STIs testing to the panel of blood work that you're going to do. Okay, so I know sometimes you hear STI, STDs, and the terms are just, also many times it's the same term where you're not sure which term is appropriate. So STIs are sexually transmitted infections. So an infection is actually when the body is introduced to a bacteria, a virus, or parasite. So that's when the infection is introduced into the body. Often, many times in infection, you don't show any signs and symptoms. So the virus or bacteria is inside your body, but it's just there. You're not ill from it, or there's no sign that you have an infection. However, when an infection now becomes obvious and there's signs and symptoms, that's when it becomes a disease. So sexually transmitted disease is actually when it's confirmed and you're showing signs and symptoms. An infection is just more when it's introduced into your body, but there are no signs and symptoms. So the purpose of this video, I'm actually going to use the term STIs, or sexually transmitted infections. I'm not going to use diseases. So I'm going to talk about, I'm going to do two parts to this video because I find like there's just so many that I just don't want to put all in one big video. So for this video purpose, I'm going to talk about chlamydia, gonorrhea, and herpes simplex 1 and 2. And in my next video, which is going to be part 2, I'm going to talk about HPV, syphilis, and HIV. So chlamydia is one of the most common STDs. It's very, very common. It often goes unnoticed sometimes. But one thing about chlamydia is that it doesn't always show once you're introduced to the infection. So sometimes it may show like 2 to 3 weeks after having sexual intercourse with someone who has chlamydia. You may notice that you have a burning sensation when you urinate, and that's for both male and female. You notice a discharge, vaginal discharge. Often many times discharge is like a white thick discharge. It may come with a foul odor or a bad odor, not all the time though. And also, this could be a case where you will notice that there's some itching in the genital area. In the male, which is very rare, but in the male, you could have swelling by the testicles. And it's one of those things where, as you want to reflect back to the last 2 to 3 weeks, your sexual activities and thinking, if you could have been introduced during that time. Now, I don't mean like it's one time you go to the bathroom and you find that you're burning while you pee. I mean, it's a case where 2 to 3 days and this sensation is going on. Now, when this does happen, it's important to go to the doctor and get treated as soon as you can. Because untreated chlamydia, I mean like long-term untreated chlamydia, not being treated, and you keep on being reintroduced chlamydia over and over and over again, can cause long-term effects, and especially in women. Because if this chlamydia is not treated, it will travel from the vaginal area up into the uterus, the fallopian tumors, the ovary, and you could develop what we call pelvic inflammatory disease, or PID. And if an infection spreads all the way up to the uterus or to the reproductive system, it could cause infertility. So as I said, this is not like mild case of chlamydia. It's like, untreated, repeated exposure to chlamydia. So one of the things is that if you're found to be positive or tested positive for chlamydia, one of the things that has to be treated right away, and also has to be your partner treated. Because if I get the treatment and I'm good, my partner was not treated, then my partner can keep on reintroducing the bacteria to my body, and the treatment is just going to be useless then because I'm still being reintroduced to the infection. So it's important that when you get treated, you let your provider know, the people you have had sex with over the last 2 to 3 weeks. Some provider may say, okay, have them come in so I can treat them as well. Some provider may, write a prescription to give that person a pill as well. Or some provider may actually just say, need to call them so they could get treated. So whatever the situation is, it's responsible for you to get your partners treated, especially if you're going to keep on having sex with that person. So that's for chlamydia. Now for gonorrhea, the signs and symptoms of gonorrhea are a little bit more obvious in the sense that the discharge, it could be a yellow greenish discharge for gonorrhea, so that's more noticeable than chlamydia. Sometimes you may have like a cramp in your lower belly or your lower abdomen area. And especially a burning sensation when you urinate. So you may burn when you urinate, and then you may feel a cramp down there, and then you may see the yellowish greenish discharge. And also, once again, which is not very common, but it's also possible, the male will have swelling of the testicles. So that's normally something that the male will see. As I say, it's not popular, but it's something that could possibly happen in male. Now, with gonorrhea, it's also treatable, just the same as chlamydia, with antibiotics. Now, the thing about gonorrhea is that the treatment could be in two forms. You can get a single dose of ceftriaxone, you get one single dose of antibiotic treatment, or it could be over a period of 7 days. Now, whichever one that your doctor provides you with, or your healthcare provider initiates or decides to do, it's important that you follow through with the entire course of treatment. So the provider decides that, hey, we're going to do the 7-day antibiotic treatment. You need to take it all the way for the entire 7 days. Because not because, on day 3 or 4 you feel so much better, you're like, I'm going to stop taking these pills. No, because once you do that, the body can develop what we call drug resistance to the antibiotic treatment, and it may not be effective. And if you then happen to be reintroduced again to gonorrhea, it's one of those things where the drug that you took before, antibiotic, will not be effective because you did not take the full course of the treatment. So take the full course, whether you're feeling better or not. And these medications, as I must say, antibiotics sometimes does cause some nausea and diarrhea, discomfort, abdominal GI discomfort. So that's something to be aware of, but do take the entire course of medication. And that's for gonorrhea. For herpes simplex virus, or HSV, there's HSV1 and there's HSV2. Now, genital herpes is caused by HSV1 and or HSV2. Well, it's more and HSV2. However, I want to talk about cold sore. Not because cold sores are STIs, because they're not STIs necessarily. It's just a matter of herpes simplex 1 or HSV1 virus is most commonly what causes a cold sore. So a cold sore, many of us may know, is a blister that may appear in the region of the lip mostly. Could also sometimes be inside of the lip. But a cold sore is normally caused from skin to skin contact. It doesn't have to be through sex. It could be from simply kissing. It could be from exchanging the bottle or drinking from the same top of the cover, or like a straw for someone who has the cold sore, active cold sore going on right now. So I just want to talk about that. It is a form of HSV1, but not necessarily an STI. So someone having a cold sore doesn't mean that the person got it through sex, but it was through skin to skin contact. Now, herpes, genital herpes, is usually it's through sex. It could be vaginal, anal sex. You could get genital herpes. The thing about it is that with genital herpes, it is normally hard to diagnose someone unless they're having active outbreak. When I say an active flare-up or outbreak, meaning that it's actually a blister or an ulcer on the genital area, so whether it be in the penis or the vagina. Because the thing about it, once the herpes simplex virus is introduced into your body, you can be introduced into the virus and years pass and you never had an outbreak, so you just never know you had been introduced to the virus, and you have no signs and symptoms or anything of it. Maybe in the early stage you may have had a fever or like swollen lymph nodes, but it's hard to say that's when you got introduced to herpes simplex. But it's one of those things that when it comes into the body, it can stay dormant. So you could just be into your body and you never knew you got it. So one thing is that we actually don't always do routine tests for HSV1 or 2, because unless you're having an actual flare, that's where you have the blister on your vagina or penis, then normally it's not really diagnosed. But when you do have the actual flare up, we would take a sample of the ulcer or the sore from the vagina or penis, and then we'd send it to the lab to get tested. But in the meantime, we would treat it with antibiotics, because it's very obvious. When you see one, you would know it's genital herpes. Now, the thing about this, I said, was that it's not done on routine blood work, because it does create an anxiety in patients. When you're going to call and say, hey, your HSV1 and HSV2 blood work came back abnormal. And it's just like, what? Because almost every point someone in their life had a cold sore. So that's HSV1. So we don't want to drive people crazy by telling that, oh, your HSV1 blood work came back positive. or your HSV2, because you may never have had it, but just so you to know that you do have the virus in your body. So if you do happen to see a source on the vagina or penis, just to know that it could be from that. And when you're having an active outbreak, not to have intercourse while you're having an active outbreak, because it's easily transferable then, because it's through skin to skin contact. So it's important when you're having an active flare-up not to have intercourse during that time. If you're having an active flare-up, we could give you antiviral medication, whether it be through pills or through creams or ointment, to treat your flare-up. But just it's one that we can cure, so it's just going to be present and there's just no cure for it. We just can manage the symptoms of the actual infection. Okay, so for all these treatments, I was going to mention to you that during treatment or any course of treatment for any STIs, it's important that you refrain from having sex during this time. And also to refrain from having sex at least 7 to 10 days after the treatment, because you want to give everybody that chance to totally get everything out of his system. So you want to give everybody that time to just entirely cleanse. So try to refrain from sex as much as you can for at least 7 days after treatment. All right, so that was the chlamydia, gonorrhea, and HSV 1 and 2. And then my next video, I'm going to do a part 2. I'm going to talk about HPV, syphilis, and HIV. Alrighty, so there's a lot said. If you have any questions, you do let me know. Thank you for watching. Be safe and be well. Thank you.